How is the organization of the healthcare system in Canada? Canada's healthcare system provides coverage to all Canadian citizens. It is also informally called Medicare, which is mostly free for all Canadian citizens as well as for permanent residents, and has the most services provided by private entities. With a few exceptions, all citizens qualify for health coverage regardless of medical history, personal income, or standard of living.
It is publicly funded and administered on a provincial or territorial basis within guidelines set by the federal government. Citizens are provided preventative care and medical treatments for primary care, physicians, as well as access to hospitals, dental surgery, and additional medical services. It refers to Canada's publicly funded healthcare system. Medicare have 13 provincial and territorial healthcare insurance plans. All Canadian residents have reasonable access to medical and physician services within paid out-of-pocket.
It's federal legislation that puts in place conditions by which individual provinces and territories in Canada may receive funding for healthcare services. There are 5 main principles in the Canada Health Act: public administration, comprehensiveness, universality, portability, and accessibility. The main principle Canada Health Act indicates that the administration of healthcare must be carried by a public authority. It includes necessary healthcare services. All residents must receive the same level of healthcare. A resident that moves to a different province is still covered, and all persons that have access to the healthcare facilities.
The provincial and territorial government are responsible for the management, organization, and the delivery of healthcare services for their residents. Canadians often turn to primary healthcare services as their first point of contact with the healthcare system. Primary healthcare includes the library's first contact healthcare services, continuity of care, which means receiving high-quality care from diagnosis to recovery. Ease of movement across the healthcare system when more specialized services are needed from specialists or in hospitals. They also provide supplemental coverage to certain groups of people, as seniors and children.
A health card is used by the Provincial Ministry of Health to each individual who enrolls for the program, and everyone receives the same level of care. Health care services that are not generally covered are vision care, dental care, prescription drugs, and ambulance services. The financing of health care is provided via taxation from both personal and corporate income taxes. Additional funds from other financial sources like sales tax and lottery proceeds are also used by some provinces.